Hi, my name is Cassandra Munoz, and today I'm going to be going over prednisone and dimethyl fumarate. And these are medications for a newly diagnosed patient that has multiple sclerosis. So the first medication I'm going to discuss in patient education is prednisone. And this is both an anti-inflammatory and a corticosteroid type of medication. This helps if the body is facing inflammation. It will bring it back down. This type of medication, prednisone, looks like this over here. So prednisone acts by suppressing the body's immune response, but it also places the patient at risk of being immunocompromised. So allowing people that have multiple sclerosis, this medication will help them maintain coordination, and it also helps slow down the process of some of the symptoms related to multiple sclerosis. And that can be such as like bowel movement, incontinence, so they have better control over those things. What prednisone is also allowing is for the lung, if it becomes inflamed, to return to normal. It should be taken with food, so make sure that's included in patient education with these clients, and that's to help them prevent GI upsets. The adverse effects of this medication is headache, insomnia, acne, mood swings are to be expected, as well as red or purple blotches on the skin, and those will look something like this. Also, you want to make sure that they're also aware it could decrease their libido when it comes to like sexual desire. Notify the patient that if they experience any of these symptoms to immediately report to the provider. So definitely must be included in the patient education is if they experience eye pain, other vision problems, fever, seizures, and a sense of kind of like a contact with reality. All of these signs need to immediately be reported to the provider, so make sure that the client knows that. Also included with prednisone in patient education is something known as St. John's wort, and you want to make sure that they do not take this herbal product with this medication, as it can send the client into a state of mania, basically. So it's basically St. John's wort and prednisone are contraindicated within each other, so make sure that the client is aware of that. You also want to make sure that this client avoids grapefruit juice, and if they are wanting so badly to drink grapefruit juice, to call the provider so they can tell them the safe amount to intake grapefruit juice. If they've had something such as a recent eye infection, you also want to make sure that the provider is also aware prior to this medication. And other patient teachings is if they're expecting to be vaccinated, that they have to absolutely notify the provider before this medication is taken as well, because it can cause the symptoms of multiple sclerosis to worsen, and they can go into exacerbation phase when it comes to multiple sclerosis. And as I've said before, due to the decreased immune system now, while on this type of medication, prednisone, make sure the patient is careful to avoid other sick people, to make sure they're washing their hands frequently, and especially avoid those with active viruses. So this can mean kids, adults, anyone basically that has shingles, chickenpox, or measles. These are live vaccines that now that the client's placed immunocompromised, they have a chance of having worsened symptoms and possibly death if they do catch that. And that's it for the prednisone. Next, I'm going to be moving on to dimethyl fumarate. And this type of medication is also an anti-inflammatory drug used to prevent symptoms of multiple sclerosis in those types of patients. It usually helps with the relapses of multiple sclerosis, so I want to emphasize that point. So this drug can cause severe brain malfunctioning. So before taking this medication, you want to make sure that the client does not have a low white blood cell count or active infection. Another patient education for dimethyl fumarate is making sure that they swallow the whole capsule whole, and along with all other capsules, do not crush it, do not break it. Just emphasize that they have to swallow that medication as is. They're not to chew it either. Usually you can take this medication without food, but it's usually preferable with food because it can help prevent the other symptom of this medication, which is flushing. You want to notify the client that regular frequent blood tests may be ordered, so they should expect to make sure that they have their blood tests taken every so often while on this medication. For the nurses, when storing this type of medication, we want to make sure it's tightly closed, no light can get in, it's at room temperature, and there's not like excessive heat entering, because that can cause the medication to either spoil or just become life-threatening to the patient before they intake it. The common side effects we also want to include in this type of education with dimethyl, and that is like stomach pain, nausea, redness, rash, and flushing. But if hives begin to develop and about experiencing flu-like symptoms, the client is telling you that they're experiencing flu-like symptoms, that's when we immediately want to stop this medication. A low white blood count and liver issues such as jaundice or loss of appetite, that also means that we would have to stop this medication and notify the provider about that. So I hope you enjoyed this video. My name is Cassandra Munoz. I'm in class 29 and I look forward to seeing you all back in the classroom soon. Thank you. Bye-bye.